Hello, my name is Tarcisio. I'm a professor of industrial engineering at the Federal University of Rio Grande do Sul in Brazil. The title of this presentation is Running Out of Resilience, Coping with the COVID-19 Pandemic in Brazilian Intensive Care Units. This research study addresses two research questions. First, what's resilience like in ICUs during the pandemic? And second, what are the lessons learned for coping with ICU complexity? These questions were investigated in the Brazilian context. As you know, Brazil has been severely hit by the pandemic, and data collection occurred in the period in between waves in Brazil, approximately from late September last year to mid-February this year. This didn't include the worst period, which started around March this year. Our analytical framework is based on 5 guidelines for coping with complexity and supporting resilient performance. These guidelines were devised from a literature review, and they have been used in several of our studies in recent years. The guidelines are: provide Slack resources, give visibility to processes and outcomes, use a diversity of perspectives when making decisions, monitor unintended consequences, and understand the work as done. These guidelines were assessed at the macro level, which corresponds to the environment external to the hospital, at the meso level, which involves ICU work that depended strongly on other units and our top management, and the micro level, which involved ICU work with little or no dependence on other units and our top management. As for data collection at the micro and meso level, we developed a survey questionnaire for assessing the guidelines. This survey was answered by 33 respondents from ICUs from several Brazilian states. And there is also an English version of this survey, which is available at this web link. I invite you to take a look at it. 7 survey respondents were also interviewed. They provided justifications for their survey answers, and they also provided examples of using the guidelines in their ICUs. At the macro level, we carried out 20 hours of observations of the meetings of the Municipal ICU Bed Management Committee in the city of Porto Alegre in Brazil. That's the city where we live. And we also interviewed 2 public health officials who were members of that committee. As for data analysis, we carried out all traditional statistical analysis for the survey data. For example, our Chromebook Alpha was quite good. Regarding the qualitative data, we carried out a thematic analysis. And based on this, we identified 70 resilience practices, which were grouped according to the guidelines and according to the micro, meso, and macro levels. And finally, we identified 5 lessons learned, one for each guideline. I will now give you an overview of the results using the guideline on Slack as an example. We organized our findings on tables like this one. On the left, we have the survey statement. In the middle, we have here the average survey score. And on the right, we have the resilience practices identified from the qualitative data. These resilience practices, for example, on this table, they are related to this survey statement. I chose this statement as an example because it had the lowest score in the whole survey. Let's read the statement. There are extra or standby human resources that can be quickly deployed, and these are available in sufficient quantity to cope with unforeseen events. So this statement is related to a major problem during the pandemic in several countries, which refers to the lack of qualified staff in intensive care units. In order to further illustrate this finding, we have here two excerpts from the interviews. First, an excerpt from a hospital director interview. Many professionals were on their first job, no experience with critically ill patients, and of course, no experience with COVID. Then you can imagine it was chaotic, terrible. On the bottom, we have an excerpt from a chief nurse's interview. Experienced professionals who worked in these areas full of new employees didn't want to return after seeing the chaos. Moving on, the lessons learned related to Slack. According to our findings, caregivers seem to be the key Slack resource because they enabled the use of other resources and because they couldn't be easily made available at short notice. Furthermore, our findings indicated that capacity Slack must encompass a wide mix of human and technical resources, and these resources are most likely to be found out of the boundaries of the ICU, especially in other hospital units. On this graph, I can further illustrate this point. We have here the number of residence practices, and here the distribution of these practices according to the guidelines and according to the levels. As we can see here, most practices are related to Slack. And within Slack, most practices are related to the meso level, which corresponds to the bar in orange. The meso level involves resources out of the boundaries of the ICU, but within the hospital. Moving on now to our conclusions, from a theoretical viewpoint, we are proposing the concept of running out of resilience as a chronic system state. This system state is characterized by substandard outcomes being produced over a prolonged period, by slow degradation of performance, which tends to occur in human-dependent systems, similarly to most healthcare services. And this also raises the question of what's like the resilience curve for ICUs in a pandemic. This is an important question, we think, because different patterns or curves imply different management strategies. And finally, our conclusions from a practical perspective. We think that the survey questionnaire is a contribution because it allows the assessment of the complexity guidelines in intensive care units. It can be a potentially new resilience tool, and we obtained very positive feedback from respondents. The survey was also quick to be filled out. Respondents took on average 12 minutes. And the survey also makes it possible to calculate correlations between survey statements and contextual factors. For example, whether the hospital is private or public, and performance data from the ICUs. And of course, the list of 70 resilience practices can be a source of ideas to ICU in other contexts. That's all. Thank you very much for your attention.